Welcome to Toronto Children's Services Personal Protective Equipment Tips and Considerations Training Module. In this module, we will talk about the different types of personal protective equipment known as PPE and how they should be worn and tips about using them in early learning settings. It is recommended when looking to purchase PPE that it is of high quality and from a reputable source. Personal protective equipment, or PPE, is equipment that will protect the user against health and safety risks at work, such as contaminated surfaces or infected droplets. Examples of PPE used during this time in early learning settings are gloves, face masks and coverings, face shields, and goggles. Let's start with face mask and coverings. Staff must wear a surgical mask and eye protection, for example goggles or a face shield, when working in the screening area, when cleaning and disinfecting blood or bodily fluid spills if there is a risk of splashing or droplets, and when caring for a sick child or a child showing symptoms of illness. Staff must wear a surgical mask or non-surgical mask or face covering at other times when physical distancing cannot be maintained, such as but not limited to providing direct care, for example feeding, assisting a child with hand hygiene or diapering, consoling an upset child, assisting a child with dressing or changing of clothes. Face masks and coverings do not replace the need to keep a distance of 6 feet or 2 meters from others, washing hands often, and staying home when sick. This slide shows you how to safely wear a cloth mask or face covering. First, wash your hands before putting on a mask. Number 2, keep hair away from your face. Place the mask over your mouth and nose snugly. There should be no gaping. Be sure it fits comfortably and that it's easy to breathe. 3. Avoid touching your face and mask while using it. Do not leave your mask around your neck, hanging from your ear, or on your forehead. 4. Change your mask as soon as it becomes damp or soiled. 5. Remove the mask without touching the outside. If it is a cloth mask, launder it before wearing it again. If it is a single-use mask, immediately dispose of it in the garbage. 6. Clean your hands and any surfaces the mask may have touched. Remember, do not share your mask with others, and do not put your mask in your pocket because it is contaminated with germs. Put it in a plastic bag until you can wash it or discard in the garbage. It is important to use and clean a mask properly. Using a mask incorrectly can accidentally spread infection to the wearer or to surfaces. Do not push your mask on your neck. Do not wear your mask so it only covers the tip of your nose. Do not leave your chin exposed, and do not wear your mask below your nose. Here is a short video showing you 5 things to remember when using a face mask and face covering. Eye protection, such as face shields and goggles, may be used to protect the eyes from splashes, sprays, and infected droplets. Eye protection must be worn when working in the screening area, when cleaning and disinfecting blood or bodily fluid spills if there is a risk of splashing or droplets, and when caring for a sick child or a child showing symptoms related of illness. Let's move on to using gloves. Before putting on gloves, it is important to check them for tears or holes. Gloves must be worn in the following situations. Gloves must be worn when it is anticipated that hands will come into contact with mucous membranes, broken skin, tissue, blood, bodily fluids, secretions, excretions, contaminated equipment, or environmental services. Refer to the applicable Toronto Public Health Guidelines for additional information. To put on gloves, first wash or sanitize your hands. Second, put a hand into each glove, being careful not to tear or puncture the gloves. And thirdly, like masks, new gloves must be worn each time they are removed. Remember to refer to the Toronto Public Health poster that should be posted in your environment.
Project 3D.
This video
How to
shows
safely
how
remove
to
used
safely
gloves.
remove gloves using the
One has to follow
glove-to-glove
specific
method
steps
to
when
remove
removing
gloves.
used gloves to minimize the chances of cross-infection. Pinch the glove at the wrist level and pull it some distance away from the skin without touching the skin of the forearm. Peel the glove away from the hand, thus allowing it to turn inside out. Hold the removed glove in the gloved hand and slide the fingers of the ungloved hand between the glove and the skin of the wrist. Remove the second glove by rolling it down the hand and folding it over the first glove. Discard the removed gloves in a suitable biohazard waste bag or bin. Perform hand hygiene. Discard the removed gloves in a suitable biohazard waste bag or bin. Perform hand hygiene.
That concludes the PPE training module. Please inform your supervisor, director, or home visitor that you have completed this training module. We have provided a list of additional resources for you to access related to personal protective equipment processes. They can be found on the website along with this video.